In case you didn't know, medical bills is the leading cause of debt in America. Too many of us are paying much more than we should be paying. But what if you knew there's some steps you can take, simple steps to fight back and help you save money? Our guest is here to show us the way. You'll meet her shortly, but first we have to take a little break. But not to worry, we'll be back in a flash, a hot flash. It's time to shout out our sponsors, Miller Curtis Jr., Marsha Curtis Jones, and Tina Dove. Thanks for the love. And thanks to those who have bought me a cup of coffee. If you like the Ageless Glamour Girls show and AGG in general, do share at buymeacoffee.com/Ageless Glamour Girls or reach out to us at info@agelessglamourgirls.com. Thanks so much for your support. Now, back to the gems. Welcome back to the show. I'm your host, Marqueeta Curtis-Haynes. I am the CEO and the founder of the lifestyle brand Ageless Glamour Girls, where we inspire, empower, and celebrate women aged 50 plus on their ageless aging journeys. So much fun, so much fun. Welcome to the show. Now, as we were mentioned earlier, we're talking medical debt. Whew, can be overwhelming, right? Between the confusing codes, the surprising charges, debt collectors calling or texting or whatever, they're just in our grills constantly. It's seemingly there's no escape, right? But you have the power. We have the power much more than we know. And our guests, which you're about to meet, will show us the way. Oh my goodness. Yay, yay, yay. Now, I'm going to bring her up to the stage. Bam. And there she is. Welcome, welcome, welcome. This is Dr. Virgie Bright Ellington. She's an internal medicine physician and medical financial justice expert. That's good. That's a good friend to have right there. Medical financial justice expert. Welcome to the show, Dr. Virgie.
Thank you so much for having me, Marqueeta. It's always fun talking with you.
And I should say welcome back to the show because we had her on, I think, first
Yep.
season.
Yep.
The first,
That was the first season.
Yeah. And I also want to add that, Dr. Virgie, I know we'll get into this, that you're also principal of Crush Medical Debt and medicalbillrelief.com.
Yes,
and we'll
ma'am.
talk about that. And you have a book. You're author of What Your Doctor Wants You to Know to Crush Medical Debt. Again, the book is called What Your Doctor Wants You to Know to Crush Medical Debt and How to Protect Yourself. So guys, come on, look at this. We have the perfect guest to help us navigate this world of unsightly medical bills and medical debt. All right, because I know you're on a mission, Dr. Virgie. You're on a mission to rescue us from our medical debt. So let me go to our first question. And there's been so much debate about this lately. It goes back and forth, and you get excited, then you feel deflated. Many of us believe that unpaid medical bills won't show up on our credit reports. That's a hot topic, but they often do. Can you please explain to us the current rules around medical debt and what older women especially need to know to protect their credit or to protect our credit?
Yeah, it's so heartbreaking. We were so close, Marqueeta. So as of January 2025, federally throughout the entire country, all 50 states, any bill that is under $500 and less than 1 year not paid cannot be reported to credit agencies by the provider, meaning the billing provider, or debt collectors.
So now say that line again.
Let's say in a positive way. Let's say the point is that only bills over $500 that have been not paid for more than 1 year can be reported to credit agencies. The original goal that unfortunately got squashed was to have no bill whatsoever that comes from medical services, no medical bills being sent to your credit agencies, bureaus, hitting your credit score, period. That was not going to happen. It was going to be squashed. And now, unfortunately, that is no longer the case nationally on a federal level. On a federal level, the only thing that you're protected from is not having medical bills that are over $500 or under $500. And if it's been less than 1 year that you haven't paid on it because maybe you're disputing it or trying to work out the errors in the bill between your insurance, if you have it, and the providers, or even if you're paying cash or out of pocket. So that is in place. The bill has to be more than $500 and more than a year old in dispute and paid for it to be sent to credit bureaus, meaning to hit your credit score.
Gotcha.
So
Gotcha.
that was the point of the CFPB, the Consumer Financial Protection Bureau, trying really hard to get that in, and they almost got it in, and it got squashed at the beginning of the year with the new administration. So the thing is, they're punting it to the states, Marqueeta. So what they're saying is that, you know what, the states' rights, state sovereignty. Okay. As of now, there are only 4 states that will say you can't send any medical bills to credit reporting agencies. If you live in the state of Colorado, New York, Connecticut, and last month or this summer, Oregon, right now are the 4 states that have implemented what the CFPB, the government, was trying to do with protecting all consumers in this country from bad medical bills or not being able to pay medical bills.
Wow, that I didn't know that about the 4th state. So
there are many others that have some.
I'm sorry. Go ahead.
No. That's it's confusing. There are many more states that have the bills that they're discussing in their states' legislators, but they have not been signed into law yet. So it's really the overwhelming majority of the states, except for bills that are over $500 and more than 1 year old, they can all be sent to. Let me back up. If it's in any state, except for the 4 states, Colorado, New York, Connecticut, Oregon, if it is a bill that is more than 12 months old, they say it's been in dispute and more than $500, then that can hit your FICO score. They can report that the providers who originated the bill, and or if they send it to collections, the collections companies can send it to your credit report and affect your FICO score, your credit score.
Whew. Wow. Okay.
So there are other states that are discussing the issue, but as of right now, it's still, for the vast majority of us in this country, outside of those 4 states, it's a problem. It'll hit your FICO score, your credit score.
Wow. And I'm torn now because I really want to talk about those codes. Right.
Yeah, let's talk about the codes, because that's where the money is, Marqueeta. Let's talk about them.
Billing. We'll come back to the billing, because I want to know what people can do. Is there a way that you can negotiate? But let's go back to the codes.
That's move number 1.
Those things are too confusing. Those codes. I don't understand those. I just need some basic stuff, because I know there's some coding for Medicare and this and that. How can we keep an eye on our bills and spot the errors?
1 set of codes, just 1 set of codes.
Oh, okay.
CPT codes. That's all you want. That's all you need. Now, there is a subtype of CPT.
I'm sorry, you said CPT codes?
CPT codes, as in can't pay this codes.
Now, I'll remember that, can't pay.
The real term is, fancy, common procedural terminology, right?
Okay.
But that's why everybody calls it CPT codes.
Got it.
And if you just need to remember, okay, what are all the alphabets? Can't pay this. Just keep that in mind.
Can't pay this.
That's what you're looking for.
I like it.
So there are a subtype, though, of CPT codes called HCPCS codes, HCPCS. Don't worry about all the alphabets. You'll see on a real bill from a provider it'll say CPT, or it'll say CPT/HCPCS, CPT/HCPCS. That's what you're looking for in a real bill. You're not going to pay anything that doesn't have CPT codes on it. So think of medical services in the United States, any medical service you can think of, Marqueeta, think of any test, any office visit, any emergency room visit, any procedure, any operation. Those all have their own unique CPT codes. So, so think of it as like barcodes are, well, I call it basically barcodes for medical services. CPT codes are to medical services what barcodes are to products in a store. So let's say you have your favorite water brand, right? And you're going to your local bodega and you know what? You're really, really thirsty this day. So instead of getting your usual 8-ounce bottle of your favorite brand of water, you get a 16-ounce bottle. Well, when you zip it across the little cash register reader, right? Up will pop the description, a brief description of what you're buying and the size, right?
Right.
Because the price is going to be different than for the 8-ounce.
Right.
This time you got a 16-ounce. What's going to pop up when you run that code, that barcode, right? It's going to be different than what you usually run with your 8-ounce bottles when you run that across. Same thing with medical services. If I have an ER visit, and let's just say, you know what, I needed, I was really, really dehydrated. I had a really nasty gastrointestinal GI issue, gastrointestinal intestine. I think I should be able to say it, but that's why I call it GI, gastrointestinal issue, let's say. Super dehydrated. Well, that code I get for that visit is going to be different than if they rolled me in from, serious pneumonia and I can't breathe. And so 2 different scanners. So that's where the money is, Marqueeta. CPT codes. You got to get that. A bill that doesn't have it, if it just says labor and delivery. Let's say you go in to have a baby, labor and delivery, and skin to skin, and total, $19,759. Well, wait, what? What is skin to skin? Wait, what?
Right.
Actually, that's an example of something a young lady who had her first baby posted this on TikTok, probably now 2-3 years ago now. And there's no such thing. There was obviously no CPT codes on that. And the reason why I knew that, even before she put her bill up on the screen, I knew that, Marqueeta, because there's more than 300 and probably 50,000 CPT codes. Although there's no way that you're going to memorize any of them, I do know that there's no such thing as skin-to-skin contact. What that was describing is saying, hey, as soon as the baby is delivered, it gets put on the mom's chest. Wait, what?
Wow.
They charge separately for that. That's not a thing. Right. So I always explain, you get rid of, I'd say about 80% of the foolishness that folks try to sneak in with these summary bills gets wiped away when you call and ask for a real bill. You're going to call and ask for, quote, something with CPT codes, unquote. Or, you know what? If you just cut to the chase and say, hey, I need, quote, my UB04 form for a particular date of service. Unquote.
Now you're saying U is in up and B is in boy?
Yes.
Okay, it's UB what again?
-04 or UB04.
Okay, and that's the code that when we see something, we get a bill and we're looking at it, and it's like, what the hell is this?
So what happens is, often you'll get pushback. Unfortunately, the folks on the front lines are often trained to say, well, what do you mean, something with CPT codes? You know what? You're going to have to talk to medical records about that.
So that's where you start with medical records, or that's what they're telling them.
That's what they're going to make you believe.
Right.
But no, no.
Oh.
As per HIPAA law, you have, people think HIPAA law is a privacy law. Actually, it's in the name. Privacy is not in the name. It's, everybody knows it as privacy law, but it was actually the Health Information Portability Act. So it means that every person owns their health information, including the information that involves billing and payment of the services you received. So unfortunately, they still do this. I'm surprised when I talk to folks and they get the runaround in terms of just asking for their real bill or something with CPT codes, because they're trained not to let us have this information because that's where the money is. So I say, you know what? I've told people to start asking for UB04 forms, because they'll instantly know that you're not playing. You know what you're talking about.
Oh, good
That they
to
can't put it
know.
over. They can't just say, "Oh, wait, what?" Yeah.
Oh, that is really good to know. So that's what you need. You need the UB-4 code, and
No, not code. It's a form. So
I'm
it's the
sorry,
form
the
that they
form.
send to insurance companies.
Right.
You know, whether you have insurance or not, they're going to fill out this form. This is a standard form, especially it was really built for Medicare, but Medicare, all insurances basically follow Medicare within 2 or 3 years. So now it's ubiquitous. All the insurance companies use the UB04 form to find out what services their members received and what the provider is asking them to pay for.
Okay.
And it has a CPT code. So, you know, if an insurance company would never, ever pay anything that doesn't have a CPT code, why would you?
Right.
Right.
Right. And so once you're armed with that information, the you're filling out the form, can you compare, if you get a big bill, it's like, can you compare it to say, if somebody else had a similar surgery or whatever, can you compare notes like that to make sure you're not being overcharged, or is that hard to do?
So yeah, you're not going to compare the services you receive to other people. You're going to compare it to what the standard most fair
standard.
Is for that. And that actually was done for you by the federal government with the rate set by Medicare, meaning what the federal government will pay for insurance for their, basically, for people think of as insurance for old people over 65, but it's not just for folks over 65 who don't have insurance, their employer. Yes, that's a primary coverage, but there are also folks who are young who have certain chronic medical conditions. So the CMS, the Centers for Medicare and Medicaid Services, they came up with basically what they're going to pay for every CPT code that they decide is medically necessary that would be covered.
Gotcha.
So that's why you're going to say, I'm going to get the CPT codes and compare it to what Medicare pays for each service, for each CPT code. That's step 2. Okay. And that's why the money is in the CPT codes in step 1, because that's exactly where the money is. Medicare pays the lowest rate that providers will accept in the United States.
Okay. And so once you're armed with those numbers, then you could go
exactly. Now, there's a couple of issues with that. Not every provider, I should say, accepts Medicare. And that's okay. And most of us don't actually have Medicare. And that's okay too, because you don't have to have Medicare as be covered by Medicare, have that as your insurance. And the provider doesn't have to accept Medicare for you not to get overcharged, for you to know what a fair rate is.
Fair. I like that phrase. Fair rate.
Is the folks that are doing this work with helping folks with basically medical bill advocates say a fair rate to pay is 2 times the Medicare rate, because the Medicare rates are so low. And then that's the argument many providers and many hospitals say, well, you know what, if everybody just paid Medicare rates, we couldn't stay in business. Okay, so let's try 2 times Medicare rate. That's deemed the most fair rate for medical services you could receive in the United States.
Okay.
And now you can look that up. You can, so in step 2, once you've got your CPT codes, I tell people, I used to say Google it, but now really AI, whatever your favorite AI platform is, ChatGPT, Perplexity, just put it in and the CPT code, and up will pop 2 things: a brief description of the medical service you received, just to make sure that you weren't billed for like a non-emergent ambulance ride or something like that.
Right.
That you weren't billed for a level 4 or level 5 emergency room visit when you just came in, you just needed fluids because you were dehydrated from your GI issue, gastrointestinal issue, right? So that's why it's so important to get the CPT codes. That's where the money is. And you're going to compare it to the most fair rate, 2 times the Medicare rate. That's the number that you're going to pay. That is your new bill. You're going to take to step 3, total all those numbers up, all the CPT codes up.
Mm-hmm.
Step 3, call back the provider and say, yeah, you sent me a bill for $10,000 for that emergency hot appendix, appendicitis surgery. I had to have my appendix removed last month. But in my case, quote, I am willing and able to pay $3,000, unquote. Now, you're not going to tell them that you got this information from Medicare, because as soon as you say that, they're going to say, well, we don't take Medicare, or you don't have Medicare, and they'll just hang up on you, right?
Right. Good to know.
You don't need to tell them where you compared your prices, where you did a price check. So step 1, pull the CPT codes, pull where the money is. 2, do a price check. And 3, push back. You're going to take those numbers, total up the numbers you got in that comparison, that price check of fair rates, 2 times Medicare rates, and call them back and say, this is what I'm willing and pay. Who can I speak with? Who can help me?
Okay. So you call your provider or your doctor's office.
The billing office. And they'll usually have that on there. On the first bill you get, I usually say, probably the first bill is a fake bill. It is what it is. I don't want to.
Right.
I don't like to say it that often, but usually
right.
the first bill is a fake bill. I call it a wishing number. The number that they have on there, that they put on there, is usually in the upper right-hand side. I call it the wishing number, because they're wishing and hoping and praying that you'll fall for it. Right? Wow. Underneath it, they'll say, hey, questions about your bill, call la 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 la. Right. Yeah, that's the number you're going to call. Yeah, I have questions about my bill. Where is the real bill? I didn't see CPT codes on here. And if they say, well, you got a real bill with CPT codes, say, okay, can you show me where the CPT codes are? Where's the numbers that are connected to the medical services that I received? Now, the reason why I bring that up, Marqueeta, and you were saying at the top of our discussion, is that there are a lot of numbers. Yeah. So often I tell people, do not ask for an itemized bill. You're going to see that everywhere. Ask for an itemized bill. No, don't do that, because an itemized bill may just have these funny little numbers and codes that are just internal to that medical center or that hospital, that provider.
Right, for a Band-Aid or whatever.
You don't know what it is. Right. It's not standardized. It's not a CPT code. It means nothing.
Got it.
An insurance company is not going to pay for a service code or a detailed bill that has these random numbers. That's not a CPT code.
Right.
So think about it. If an insurance company is not going to pay for it, you're not either.
Woo. Okay. That's already, we are armed with. We're armed to go back to them to ask for stuff, and I like that, because we know we have to keep. We have to advocate for ourselves, or somebody you're living with who's unable to do themselves. Make those calls for them.
Exactly. You're going to advocate for you or your loved ones. Absolutely.
Now, thank you for all of that. I want to ask a question about the let's go back even before medical bill end up in collections, before people even have a chance to resolve them. What's the typical process hospitals or providers follow before sending a bill to collections?
You can ask the question when you call, that third call that you make, or the third step, meaning the second call you make, to call back and say, hey, this is what I'm willing and able to pay. If you can't pay it all at once comfortably, then, who can I speak with? Who can help me with a payment plan? Now, I do want to, I'm actually going to ask us to hold on to that thought for a second.
Okay.
What I'm talking about are bills that are not hospital bills. So there's two categories of bills. One set of bills, if you got a bunch of bills, break them up into hospital bills and bills that are not affiliated with a hospital or a medical center. The bills that are from a hospital stay or affiliated with a hospital, you're going to ask for what I call a financial aid or financial assistance or charity care application. The fancy name is sliding scale income-based discount application, because every hospital is different, but they offer discounts. Some are very generous, some are stingy, and is basically not offering a discount at all.
Mm-hmm.
But they will offer basically a discount, or they have a formula that if you make a little amount of money compared to the size of your bill, it gets deeply discounted, and in some cases even wiped away. So if it's a hospital bill, before you do the 3 steps, ask for, you want to make sure that I always say do the first step just to make sure that when I mean the first step, meaning asking for CPT codes or real bills, so you can see all the CPT codes to make sure you're getting billed correctly, that you're not getting billed inappropriately or for services you didn't receive. That's how you can get overbilled. And getting billed for a level 5 ER visit when it really was a level 1 or 2. Right. So you do really want to see in your hospital bills, you want to see, or bills from providers related to a hospital or a medical center system. You do want to make sure that all of the CPT codes describe the services you received. But that's where you stop with hospital and hospital affiliated bills, because you're going to say, okay, if the services look like all of the services sounds like the services I received, you're going to call that number in the billing department, under it says billing department or billing questions, under that big number on the upper right hand side. Usually you're going to call that number and ask for, instead of asking for, look, let's discuss a payment plan, or let's discuss the actual fair price and what I can pay. Before you do that, ask for a financial aid, financial assistance, or charity care application, a sliding scale income-based application, because sometimes it wipes it away. You don't have to go through the next 2 steps, making sure that it's, comparing it to a fair price, 2 times Medicare rate. And you don't have to call back and negotiate, or automatically negotiate, saying, hey, this is what I'm able to do. So I say that to always get your codes, just so you know that you're not being overcharged. Make sure you got it sounds like the care you received.
Right.
The hospital bill, call and ask for an application to apply for financial aid and financial services. But for non-hospital related care, or not services from departments or providers that are not related or connected to a hospital, then you're going to do the 3 steps. After you get the CPT code, make sure it sounds like the service you received. Then you're going to go and look at what Medicare pays 2 times that rate for each of those codes, total up, and then call back and say, yeah, we need to discuss this. This is, in my case, I'm willing and able to pay this amount in your head that came from that new total of that price check you did. Pull the CPT codes, price check, and AI search basically for the most fair Medicare rate, 2 times Medicare rate, and 3 pushback.
Okay. Now, that is with the hospital itself, right? You're talking about negotiating with that.
Yeah. So the hospital's billing department,
right,
and then the provider's billing department, if it's not related to if it's not a hospital or hospital affiliated provider.
Okay. So I'm just trying to make sure I have this right. So if it's already with a collector, then what options?
At that point, okay, so now we're getting into the Fair Debt Collection Practices Act. So that's we're really protected with that. Actually, it's not as bad as it sounds. Don't panic is rule number 1, because you have 50 years of protection in that. Number 1, they have to document that it's your bill, and they have to get that information to you within a certain period of time. I believe it's 30 days.
Okay.
But when you're first notified, usually by mail, or if they happen to, I tell people, don't answer. There's no reason to answer the phone anymore, by the way. Don't answer. If you don't recognize the number, why answer the phone? Come on, think about it.
Then they have your number, so they'll start texting you.
And so the next thing they're doing is like, okay, they're hip to us, right? They know we're not picking up the phone anymore, so they'll text you. If you want to ignore the text, you don't have any documentation from the text. What you can do is say, okay, you know what? If you choose to respond to the text and saying, I don't know what this is. If this is in relation to a bill, this is how I want you to contact me. I want a letter
Mm-hmm.
and snail mail, certified letter,
Mm-hmm.
but basically at least snail mail. And I want documentation that the bill is mine. Actually, the first thing you really want to do is after you say, you know what, I need them to prove that this bill is mine. Where's my signature? But you also want to say, you know what, who are you people? Do you have the right to collect this bill? You want them to show you that by federal law, by the Fair Debt Collection Practices Act,
Mm-hmm.
they have to show you that they have the right to collect that bill. They need to show you the
Oh.
paper trail that
Mm-hmm.
that they bought it from the provider, often for pennies on the
Wow.
dollar. But they're like, who are you? So there's there's
Right.
there's all kinds of things that they need to show and demonstrate that it's your bill and that you even owe it before you even want to have a conversation with them.
And
Don't acknowledge the bill. Just,
mm-hmm.
what are you talking about? If you have something to say, you think I owe something, you need to send it to me. And with that, I want documentation of who you are and
Mm-hmm.
proof that you're the one who
Mm-hmm.
now legally owes the bill.
Mm-hmm.
My
Mm-hmm. Mm-hmm.
signature by federal law, you have to sign. They have to show that you signed and agreed for the services that they're coming after you for.
Wow.
And then you can say, yes, I
Mm-hmm.
need documentation of the what you're invoicing me for. What was that? What are the services?
Mm-hmm.
And if there's
Mm-hmm.
no CPT codes on there, that's wait, what? What are you billing me for? I don't know what this is.
Wow. Right. You know what? And that's interesting because years ago, I remember getting a bill and, it didn't have a lot of information on it. It was from a collector. I'm like, I knew it was a medical bill, but I'm like, what was this for? Who are you people? Like you point, you have to ask these questions.
They need to know, not only do you have to ask, most importantly, they have to provide it.
Mm-hmm.
Otherwise, they are not legally able to um, ask you for payment of this. They're not demonstrating that you owe the bill and they're the rightful collectors of that bill.
Mm, mm. Well, okay. That's all great information. Um, Now I was reading this article, many women 50 plus report having little to no savings for medical bills. And you worry about those financial strains and how they can impact your well-being. Are there practical steps, or what practical steps can women take to help avoid skipping care because of the cost? Because that's the last thing you want to do.
Yeah. So, if we're fortunate enough to make it past 39 and holding, I call it, when
Mm-hmm.
you've had, a few anniversaries of your 39th birthday, then there's
Mm-hmm.
certain things you want to do for maintenance, right? So just like for a car, to keep it running, you've got to do the oil changes every 3 months or every 6,000, 4,000 miles, right?
Mm-hmm. Mm-hmm.
There are things we have to do that protect us as we get older and as we have more miles behind us. Yeah, we
Right.
have to do tune-ups and maintenance. So there are things that you want to make sure you don't skip out on, and that's your mammograms and your colonoscopies and your annual physical exams, just to make sure that there's nothing hiding, sneaking up on you. That
Mm-hmm.
includes like uh, blood sugar tests, glucose
Mm-hmm.
tests, to make sure you don't have type 2 diabetes sneaking up on you, that kind of
Mm-hmm.
thing. Don't skimp out on that. And so what I'm telling people, if you're not at the point where you qualify for Medicare, some of us don't have insurance through our employers. That's actually happening more and more often because
Mm-hmm.
insurance is so outrageous, the cost, that employers can't afford them anymore. Then what you're going to do is this. You're going to, what I call, keep American health insurance real insurance again.
Okay.
You're going to keep
Okay.
insurance for what it's for. It is for catastrophic medical events that are unaffordable, that you can't afford. So think about it. Car insurance, homeowners insurance, or home insurance, right?
Mm-hmm.
Car insurance, if we submitted a bill for all of our oil changes in a car, or submitted a bill to the insurance for for home insurance for all of the light bulbs we have to replace, or if we
Mm-hmm.
break a window, our insurance premiums, these insurance premiums would be outrageously unaffordable,
Mm.
right?
Mm.
Same thing with, so insurance is for things that you cannot afford to
Mm-hmm.
replace, that you can't afford to pay for, catastrophic events that you can't afford.
Mm-hmm. Mm-hmm.
Keep it that
Mm-hmm.
way. let's get back to that. So what that means is you're going to pay out of pocket a small amount for what's called direct primary care, DPC, direct primary care, where it's like basically a monthly subscription that covers you, individual and or your family members. And that's your primary care taken care of. So you can go to them for little things, a bladder infection or, a cold that may not be just a cold anymore. It's been hanging around too long. And your annual physical exams, your pelvic exams, pap smears, you're getting your mammogram set up. There are some DPCs that are affiliated with some radiology practices so that some radiology services are also covered as part of that relatively reasonable, basically like $75, $100 a month per person for direct primary care, for your primary care services. Make sure you don't skip going to the doctor.
Yeah.
Just for your maintenance, okay? Or if something isn't, you're not feeling well, right? So that's taken care of. What you're going to do is back that up with catastrophic medical event insurance. That's accident, critical illness, and or hospitalization insurance. That's what you're going to say, okay, I'm going to have to reach out to an insurance company and apply for this coverage for catastrophic medical events, because even those premiums, if they give you a policy, even those premiums are a fraction of what you're paying every month for, like with the ACA, the federal marketplace, or what people call Obamacare. That's what you're going to do. That's what I want women to remember before they get to Medicare. If they're in between, if they don't have health insurance through a provider, they can't afford to go on the exchanges, the Obamacare, the federal marketplace, the ACA, then you know what? Go on, I think it's dpc.org, but look up, just put in direct primary care, and that'll pop up. There's like multiple different choices, but basically it's directprimarycare.org. And it'll send you to a link where all around the country, put in your zip code where the nearest DPC practice is, and you go from there. Make sure your primary care is taken care of. And then once you got that in place, reach out to an insurance broker to cover catastrophic medical events. Use insurance for what insurance really is for. And so you're not going bareback, right? I don't recommend that. I don't want you to be at risk of destroying your financial future because you got sick or injured, right? That's not fair.
Because, you hear horror stories every day, on the news. It's, as we know, the bills could wipe you out. Can wipe you out.
One accident. Most Americans are just one accident or injury away from a lifetime of debt or bankruptcy.
And I want to throw something else into that mix. Scammers. Of course, older people, we are the targets of so much scams across the board. But medical bills also, right? Medical bills, fake medical bills, debt collection calls. What are some of the red flags that we need to look out for? What should we pay attention to?
Again, don't pick up the phone. Like, that's just like, that's like so old school. Get hip to, you're in the 21st century. Come on, stop picking up. Don't be that old school where you pick up the freaking phone. If you don't recognize the number, don't pick it up.
Exactly.
And if it's important, they'll leave a message, right? And even if they say, oh, you need to call back, this is, if it doesn't sound like anything remotely that you recognize, you don't need to call them back, right?
No,
they're not your mother. Right? They're not your daddy.
Right. Don't call them back. Right.
So anyway, I just have to get that off my chest because a lot of scamming is still done by phone. That's like, so anyway, yes, but now they're getting more sophisticated. They'll do texts, they'll do emails, again, if it's not from if you didn't use that company or that provider, then that email goes to junk. Spam. Right?
That folder gets bigger and bigger by the day.
Right?
So many scam artists out there.
Right. So that's the number one thing you can do. Don't engage. They're trying to figure out how to engage you. Don't
Mm-hmm.
engage with
Don't
anyone that you
engage.
don't know. If you
Mm-hmm.
didn't call them, if it's really important, they will leave a message or they'll send a certified letter. That's it.
That's
There's no
true.
reason for you to engage with anybody. If you have to engage with somebody that's a stranger, assume it's a scam.
Right. There. I like that. That's a big red flag. I like that. All right. As we wrap this, on top of everything else, as we already mentioned, medical bills can be overwhelming. Now, I want to wrap this with, if you could give our audience 3 simple strategies they can use right away to take control of their medical bills, what would they be? Just briefly, just 3 top strategies.
You know, number 1, 2, and 3, get those CPT codes. That's where the money is. You get
Mm,
rid of 80%, like I said, most of the foolishness, just get those CPT codes. And how do you do that? With that first bill, often it's a wishing bill, it's a wishing number. You know, they're wishing and hoping and praying you'll fall for it. Make sure it has CPT codes. If you're not sure, call them. Call them and say that number at the bottom, underneath with that magical number, again, where they're wishing and praying you'll fall for and think it's a real number, like that's what the amount you really owe. Usually you don't owe that number.
mm-hmm.
You're going to say, hey, I need a bill or I need something with CPT codes. I'm not sure what the statement is. I need a statement with real, let me back up. I need, quote, a statement with CPT codes, unquote. Or I say, quote, something with CPT codes, unquote. And I have people who will say, you know what? No, I just go to, I want a UB04 form for the services I received on this particular date.
Mm-hmm.
CPT codes, top 1, 2, and 3. If you just do that, you're way far ahead of the game
Way ahead
because
of the
you're
game.
armed with where the money is,
Mm-hmm.
what you really,
Mm-hmm.
really owe.
Okay. Do you have anything you want to add that we didn't cover today?
Oh gosh, you know, it's, really knowledge is power. And in this
Mm-hmm.
AI age, all you have to do, Chat GPT has free accounts. If you don't want to pay the $20 a month for Chat GPT,
Mm-hmm.
get those CPT codes and just put them in Chat GPT. Or if there's another AI platform that you like, and just make sure it sounds like the services you received. You're
Mm.
going to go you're going to go a long, long way with that information. That takes care of a lot of where, unfortunately, hidden things, big unaffordable bills that you don't owe are hidden. And you can protect yourself from that. You can do it.
I believe it. I believe it. I am going to exercise all of this stuff that you mentioned today. Yeah, because my husband and I both have received bills that have nothing to do with us from the hospital here. It's like 7 and 8 thousand for some surgery. I'm like, what surgery was this? Nobody had surgery.
I think I
Yeah,
remember that. If I had surgery, that's something I would not forget.
exactly.
That would not just slip my mind.
Right. And we're like, we didn't even call, we didn't call. And it's so weird because we recognize it, as it came from the hospital. So I don't know. We didn't know what was going on, but yeah, that was a couple of years ago. And they sent 2 bills to each of us and then it went away. So, yeah.
Now, you mentioned scams. I'll end with this. You did mention scams.
Mm-hmm.
Unfortunately, there are people who are sending bills that are from quote unquote ABC hospital system,
See,
right?
mm-hmm.
And they're just creating this in home, doing a cut and paste on their computer and on their printer.
Wow.
And there'll be a number for you to call, and you're going to be
Uh,
like, oh, this bill doesn't belong to us. This is not the right bill, and you'll call the number.
mm-hmm.
Never, ever. You know how they say never say never?
Mm-hmm.
Never call the number on a bill that you don't recognize.
Mm-hmm.
Even if you
Mm-hmm.
recognize the medical center, if you don't recognize the date of service or the services, then that's likely a fake bill. What you're going to do is
Exactly.
right? Fake bills. We talked about this.
Right.
Unfortunately, first bills are too often fake bills.
See,
And
fake
what you're going to
bills,
do
fake
is
bills.
go online and
Mm-hmm.
find the number to information services or billing services to the medical center.
Mm-hmm.
Never the number on that piece of paper, because of course they have it set up.
Of course. Yeah.
Oh, great. Yeah. this is, Jane Doe from ABC Medical Services. How can we help you? It's part of the scam.
You know what? Now that I think about it, I still have the bills. I stuffed them away because we didn't even call because we knew that we hadn't had any surgery. I should have sent those to the hospital.
I wouldn't even do that, to be honest. There's internet complaint services. Every hospital, every police department now these days has an internet complaint department. And so what you can do is look it up online at your local police department. If they don't have it, the federal government has an internet complaint line, a federal internet complaint line.
Oh, that's good to know.
But, that's for bills that, quote unquote, bills you would get from by email, right? They spoof or it looks like initially like it's coming from the hospital in your email, but if you look at the return in the URL address,
and there's something wicked there.
Yeah, it's not strange. Right. So if you don't so that's for email, but for snail mail, I would take that. That's a attempt at fraud. I would take that to my local police department.
You know what? That's a good idea because I still have it. I still have those because, like you said, the first red flag was, oh, these are some bills for surgery. So I'm like, we haven't had any surgery. So, you don't call, you do anything, you just stuff it away. I'm like, okay.
If you don't call them, don't engage. If they sent it to you, mailed it to you, emailed it to you, called you, texted you, it's not for you. That's not real. Assume it's a scam and take it to your local police department, because if they collect enough of it, something can actually be done. They can catch these folks.
Okay. All right. This has been great. This has been so good. You're chock full of information. Thank you about helping us manage these medical bills and handle our business. We've been talking to Dr. Virgie Bright Ellington, internal medicine physician, former health insurance executive, and medical financial justice expert. Again, her book is called What Your Doctors Want You to Know to Crush Medical Debt. All this information will be in the podcast description, and you'll want to stay in touch with her. And all of her social media links and any other websites will also be there, including the one that we mentioned earlier about Crush Medical Debt and medicalbillrelief.com. That's medicalbillrelief.com. Thank you so much, Dr. Bright Ellington, Dr. Virgie Bright Ellington, who I call Dr. Virgie.
Marqueeta, thank you so much for having me. I always love talking with you. Thanks for what you're doing, sharing sharing this really important information with folks, with our ladies. Much appreciated.
All right. Thank you. So today's conversation reminds us that medical bills don't have to control our lives. With the right tools and the right knowledge and the information that Dr. Virgie just gave us will help hopefully put all of us on the right track. And just stuff to keep an eye on at all times. So I'm so glad you're here. Thank you so much for being here. And don't forget to follow us on our social media. Everything is at agelessglamourgirls.com, at agelessglamourgirls.com. We're on YouTube. We're all over the place. We have, Ageless Glamour Girls YouTube channel. Please subscribe to that channel and follow us there. Please subscribe to the podcast, Ageless Glamour Girls Podcast. And check us out because we're everywhere you get your podcast. We're there too. All right. And I hate to say goodbyes there, but we have to go. So until then, lovies, here's to healthy aging and joyful living. We'll reconnect real soon. Bye-bye for now.